Welcome back to our channel. I am Terry and Elaine, proud autism mom, and we are here to share with you tips and tricks of how we navigate through our journey right here on the Autistic Edge. Now, one of the many challenges faced by parents with children on the autism spectrum is communication difficulties. And communication difficulties, as the word suggests, difficult. It's difficult for parents to understand their child needs or to even understand them generally. And this can lead to frustration and misunderstanding in the parent-child relationship. And another thing too is that it can cause misdiagnosis, especially in the case of a health situation. Now, you stay right there. We will be right back because we will be sharing with you some techniques as to how you can deal with the communication challenges faced by these parents. One of the first tips that I'll share with you this evening is to be patient. Did I say patient? Yes. Now, if you have not yet watched last week's video, right here you may go back. We have put there some tips and techniques as to how to develop patience in general. Now, I have gotten a lot of feedback. I've seen some parents saying, listen, it should have been just tips for parents, full stop. I understand because we are talking about autism, but they are general tips that can be used with all our children. Now, if it applies to you, then go right ahead. All right. Now, so be patient. Number 2, in communicating with children on the spectrum, use visual aids such as pictures, charts, objects, right? Videos are also good for communication as well, because sometimes by them watching some videos, you can see what they like and you can use that as a platform for developing communication with them. Social stories as well. Social stories are very helpful for teaching routine tasks. For example, if you're teaching a child how to brush their teeth, you can come up with a visual aid outlining the different steps and using pictures that they will associate with in the process. And we will be sharing with you at some time as to how to write or how to make a social story for your child. All right, so use up your visual aids that you have at home, whether it be pictures, objects. One recommendation for pictures: when you're using pictures, make sure that the pictures are bright and realistic, and if possible, ensure you have white background for your pictures, because that will kind of make the colors more bright. For example, if you're teaching your child about knife, don't show them a picture with the entire table setting. Show them a picture with the knife only, right? So this will not confuse the child. So it creates a more clear communication in what is it that you are trying to do. All right. Children on the spectrum does not like when a lot of information is coming at them at once because of the whole sensory issue. So use a simple, clear language when communicating with children on the spectrum or children with communication difficulties. Make sure that your sentences are simple, if possible, one word or simple phrase in communicating with them. Avoid metaphor, avoid long sentences, right? And that will make your communication more easier. All right. Use sign language. Number 4, use sign language. Depending on your child, if your child is able to learn sign language, you know, we started out initially with some simple sign languages with Alex Xavier, and as we go along, we realize that Alex was able to pronounce the words surrounding what we were teaching him. So when we realized he was capable of using his words, we tend to do less sign language and try to reinforce the words more, and they are coming out, slowly but surely. So use sign language with your child. Number 5, use repetition. When communicating with children with communication difficulties, when you repeat or reinforce the message, it will help them to understand. So key points, if you are talking about a ball, right? Talk about the ball. Don't say, okay, and the round thing there on the floor. No, let's use the word ball. Be precise in your communication and repeat the name of the object or the item for reinforcement, right? This can help to better understand what you're trying to say. Number 6, maintain eye contact. Maintain eye contact. Position your face directly in front of the child. No, I did not say you should be up in their space, but give yourself a comfortable spacing between your child that will make your child comfortable. But bringing down your face in front of the child, that will give the feel of you coming to their level. And when you maintain that eye contact with them, that's one of the way of getting their attention, right? So getting their attention, coming down to their level, and help them to understand. When they see you, it will give them an idea that you are talking to them. You have their attention and they have your attention as well. Number 7, use body language and gestures. So for example, if you are saying no, or if you are teaching him no, you can shake the head for saying no, and if you are doing yes, you do the nodding of the head. So when you use body language and gestures, you engage him. So you not only engage him with words, you also engage him with action. And that's one of the reasons why for younger children or even babies, and for children who are not on the spectrum, when we are teaching them initially at first, and if you are teaching them to say goodbye, they would normally wave goodbye, or they will give you this sign for goodbye. Now, what that does, it engages them. They can associate a word with an action, and that will help them to communicate better. So if they can't use the words, they will use the gesture until they are able to use the words. But that will aid in your communication. Sometimes the child will come and pull you. Now, when they pull you, what that tells you is that they want something. Now, use that opportunity to teach them a word or two. So if they are pulling you, you can teach them the word come, because it means that they want you to do something for them. So they are pulling you towards something. So use that opportunity, because now you have them fully engaged when they are pulling you. So don't get up, sit, maintain your posture, and maintain that eye contact with them, and try to teach them to say, come. We are currently working on this specific recommendation with Alex Xavier, because Alex Xavier have a tendency to pull you towards what he wants. So what I will do is maintain my position and allow him to use the word come. Now, there are times, if you know the word that the child is trying to say, you can do a little imitation to kind of assist them with the words coming out. Now, while we were teaching Alex to say good morning, it was difficult, and sometimes he would not say the good morning. So we'll have a little conversation around good morning. What do you say? And he would look at you as if he really doesn't understand. But by the time I fold my lip to form the G, so I will like G, and then you say good mommy, which is for him is good morning. So a little imitation, or that would be a little prompting of the words at times, will help them to bring out the communication, and that is when they are minimally verbal. Now Alex is minimally verbal, and because he's not able to initiate a conversation on his own, we will normally have to imitate or prompt him on some things. We are getting a little bit over the bridge in him doing the initiation, but it takes time, of course, so we still give him some prompting. So you can prompt words that you expect. So for example, please, thank you. You can prompt some of those and they will help. Number 8, listen carefully. Listen carefully to what your child is trying to say to you. Now, parents of children on the autism spectrum will not only need to listen carefully, you have to listen actively. So you have to be on an edge, and that's one of the reasons we call our channel the Autistic Edge, because we are always on edge. We have to be like animal, get set. You just have to be ready at all times to spring at anything or any uncertainties that may come at you. You have to be listening to what your child is saying and listen to what your child is not saying as well, because it's not only what is being said. Sometimes by not saying anything, they are saying a lot. So you just have to know your child, and it takes time. You will have to know your child over a period of time for you to understand these little, pay attention to their cues. Most of the time, children on the spectrum, they'll give you cues. And I just mentioned the pulling, that when they pull you, you know that there is something that you want there. Once they give you a clue or a cue, you know that you can act on the cue and use that cue as a form of communicating in trying to find out what is it that they need. Teach them how to wait. So Alex has a fixation to 2 toys, his Ziploc bag and his tablet. Now, what you find is that he's almost inseparable from these items. That if you are going to be giving him other things, he will want to go to the dining table with the tablet, or you want to go to the dining table with these Ziploc bags. Now, what we do is we use the opportunity to teach him wait or to delay. So what we'll do, we would put the bag in front of him and we will say, listen, it's now dinner time. So here, you'll have your dinner. Here is the bag. As soon as you finish eating, you will have your bag. Eat, then bag. Eat, then bag. Okay? And you repeat, eat, and then bag. So you repeat that a couple of times until he gets it that, hey, after eat, then bag. Now, when you do these things, keep your promises, parents, because sometimes when you promise your children things and you do not fulfill the promise, that leads to disappointment. And not only disappointment, they will in turn not trust you. So guess what? The next time, if he eats his dinner and then did not get the bag, you know, next time you are going to have a problem with that same instruction or similar instructions, as a matter of fact. So try your best to ensure that whatever you promise your child, you fulfill the promise. You can develop some trust, and trust will have better communication with your child. Know what toys they like. Know what toys they like. You can use their favorite toys as a bargaining chip. You can use it to initiate communication and that kind of stuff. Number 9, if your child is nonverbal, you can also use the process of elimination to identify issues. So for example, if Alex is in a meltdown mode or a tantrum mode, we always have to use a process of elimination to understand, because he's not able to communicate with us to tell us exactly what he wants or what is happening to him. Now, I give you a perfect example. A few weeks ago, for an entire 1 to 2 weeks, we found that Alexander was in a very mad mode, and he would be going into frequent, meltdown, some of which looks like tantrum, and sometimes you don't know the difference. Now, when he goes into that mode, the first thing we have to try, okay, is he hungry? No. All right, because he would have just had dinner. So we say, okay, he's not hungry. Because there are two favorite toys, his tablet and his bag, we try to make sure that he has those. Now, once he has those and he's still in that mood, it means that something else is wrong. All right, you would observe him to see, is it that there was anywhere where he was showing signs of discomfort? So you will observe closely to see if he would be touching his tummy or anything or anywhere on his body to at least indicate that he's having some discomfort, and we weren't really seeing that. But one of the things we noticed is that he was hanging on to his head, and he was like holding his head. So sometimes he will hold the head, sometimes he will hold his ears. So right away, we said that there could be an ear infection going on. But one of the things that normally sparks an ear infection, if he spends extensive time in the pool or in the water, we would normally have ear infection from time to time. However, that was not the issue because he has not been in the pool for a few weeks. So now we are saying, nah, it couldn't be the pool. So what else could have been causing this? And then you start looking at every single thing. Now, by process of elimination, we have eliminated a number of things that were not happening. But for days, it kept on going like that, and they were frequent, of course, annoying, not getting enough sleep, not understanding. And for us, it was just overwhelming because you're not able to soothe him, because all of the soothing technique that we would have had and tried with him before, none of them was just not working. It's like the Spirit said to me, all right, Terry, check his mouth to see if there's anything going on in his mouth. And right there, lo and behold, we observed that his incisor tooth was coming down. Now, what happened is that the baby tooth was removed the last time we went to the dentist, and the gum was now healed up, and as if the tooth was now coming down and it was piercing through the gum, and we realized that there was also a little inflammation there. And that was when we realized that this is where our challenge were. Now, it took us nearly 3 weeks to figure that out. And because, guess what? He wasn't touching his cheek, because if he was touching his cheek, we would have somewhat know or realized that something was going on in his face. But he kept holding his ears, and from time to time he does the holding of the ear, and that is when he has sensory issues coming at him, like if there are loud noises and all of that, then he will react by covering his ears. So covering his ears did not tell us that this was a tooth problem. So by process, and you get the gist of what I'm saying. So a process of elimination, sometimes by looking at activities leading up to the time of when he has the meltdown, then that can give you some idea of what was happening in his environment. I must say to you, parents, it is not easy. It is challenging when you have to do all of that to understand your child. But it is important for you to know your child so that you can see the triggers and understand them when they are coming on. And especially if it is in health situations, you will have to quickly be able to diagnose what is going on with your child. Now, because it is so difficult and it is complex, it can be overwhelming for us as parents. Now, this list is not exhausting and it's not conclusive. There can be many other factors. By knowing your child, you may develop your own strategies as you go along for communication with your child. And I'm sure if you talk to other parents as well, they may have other strategies that they may have developed. Number 10, seek professional help. I want you to note that there can be other underlying factors why a child on the spectrum will have communication difficulties. And for you to ensure you get the proper diagnosis for your child, and also to ensure that the appropriate treatment is given, it is important to speak to your medical professional. So whether it is your pediatrician, whether it is your speech therapist, if you're working with one, or consult a medical doctor, they would be able to make a good recommendation for you. Now, don't sit there and say you don't know what to do. Don't know, it is not an excuse, to be honest with you. I don't think don't know is an excuse. You can research it, you can read it up, talk to your professional, talk to your school teacher, and there are recommendations out there that can help you to understand. Sometimes you yourself as parents will have to step out of your comfort zone and learn new things, because like for myself, I am trying to learn everything that I can learn with speech therapy. Now, I am sharing all of this information with you because I have researched them myself, and I have not only researched them, I've researched them and I have tried them. I am not sharing anything with you that I have not tried or may not have recommended and know that it works for somebody else. Now, number 11, which is final and last. Every child is different and every child learns differently. It is a trial and error process. So therefore, parents, please, I know it is tough, but be patient. Be patient with your child. Once again, thank you so much for joining us in this another episode of Living on the Autistic Edge. And as you go, don't forget to like, don't forget to drop a comment below. And if there's a particular topic you want me to talk about, or if there's any question you want to ask me about how we have dealt with things, drop a comment below and we will be answering your questions. We have seen the questions coming in, we have responded to some, and some of them we are putting together some presentation to help you in a much more realistic way. And don't forget to subscribe and make sure you share the content that somebody may hear. They may be able to get some help, because as parents there is a lot that parents on the spectrum are going through, and sometimes our society does not understand. Our society sometimes just simply don't care. So we are here to care and share. Thank you once again for joining us in this another episode of Living on the Autistic Edge.